To the Ebola outbreak in Uganda, the latest government data indicates that there are 5 confirmed deaths and 18 confirmed cases. The Health Ministry is also reporting 18 probable deaths and 18 probable cases linked to the Ebola virus. Response teams are monitoring the situation in the districts of Mubende, Kyegegwa and Kasanda, all in the central part of Uganda. Health officials have made hand hygiene facilities available in the affected communities. The current outbreak is attributed to the rare Sudan strain of the Ebola virus. In early September, a 24-year-old man from a small village in Mubende district became the first person to die of Ebola in this latest outbreak. We're joined by Patrick Otim. He is the Health Emergency Officer for the Ebola Response Program at the World Health Organization Regional Officer for Uganda. Thank you very much, Patrick, for Africa, I should say, WHO Regional Office for Africa. Thank you very much, Patrick, for joining us. Uganda is trying to contain an outbreak of Ebola. What's the latest situation report by the World Health Organization?
Thank you very much, and good evening, viewers. Thank you for having me. In terms of the latest information that we have from the health authorities and our colleagues in Uganda, it's clearly that in the last 24 hours, that is data available as of yesterday, we had 2 new confirmed cases that brought the total number of confirmed cases to 36. And as you mentioned, we have 18 out of those that are confirmed, and then 18 that are probable. When we use the term probable, we mean that these are people who died before samples could be collected and tested, but they are linked to the cases that are happening in that area. Unfortunately, we have also had 23 deaths. So this brings our case fatality rate to 64% currently, which is worrying. And the third thing, as you mentioned, is we have, from last week when we had only 1 district of Mubende affected, now we have transmission and cases reported from Kyegegwa neighboring district as well as the Kasanda district. So the colleagues on ground have really scaled up response efforts, and we are monitoring closely in terms of investigating, trying to identify the chains of transmission that are in the community, trying to identify the contacts and monitor them closely, and also scaling up the provision of care in terms of timely isolation and management of the cases that are being identified.
All right, so you've talked about monitoring, but talk to us more about the kind of assistance that is being extended to Uganda to help it deal with this outbreak.
Thank you. So we take this outbreak very seriously. So we are coordinating with partners. The first thing is to be able to provide for them additional financial resources to scale the response, because the Ebola response usually requires a lot of logistics in terms of deployment of teams for contact tracing, for case investigation, and for barriers. The second one is in terms of availing human resources on ground. So Uganda has a significant pool of experts who have been mobilized to go on ground to support this, and we have briefed their efforts with the colleagues from across the region who have joined to support them in terms of the response. The third one then is in terms of availing the materials that they need for this response. The health workers, they need PPEs that should be able to help protect them as they provide care for the patients. And then also they need infection prevention materials that they can use at the community level in terms of trying homes where cases have been identified to stop further spread in those houses. But we are also working with them in terms of possibility of identifying a vaccine candidate. As you know that the 2 available vaccines that we have for Ebola Zaire is not effective against the Sudan Ebola virus species. So a lot of engagement is currently going on with the colleagues in the research and development team at our headquarters, as well as vaccine developers and manufacturers, to try and identify a potential vaccine that could be used at this point.
Okay, so those are efforts within Uganda. What about when it comes to the region, and especially the Eastern African part? What needs to be done to ensure this outbreak does not spread to other countries?
Thank you. So usually there are 2 things we need to do. One is what is happening at the epicenter, or where the outbreak is happening, so that we can be able to identify all the contacts, because it's a contact that will become the next case. So identifying them, following them and making sure that they do not travel across the border. They remain within area where the health workers can monitor them. But as that is being done in Uganda, across the region, in terms of the countries neighboring Uganda, we are working with them also to enhance their readiness. First, to develop their capacities for detection in terms of surveillance and testing for laboratory. And thirdly, for putting together isolation facilities. In case they get a suspected case, this person can be safely isolated, and then samples collected from them, and we determine whether they're a case or not. So that is already happening across the 6 countries that are neighboring, and we will be having even a forum with them later this week to be able to discuss and see where they are in terms of readiness measures and what additional support can be provided to them to support them.
All right, Patrick Otim, thank you very much for your time.